and happy Wednesday. It is now officially August. I can't believe it. Time has just flown by this summer. I don't know about you, but I have not really accomplished all of the things I hope to accomplish, and was hoping to be able to do more. If, you have been able to accomplish all those things, that's great. I am excited for you. But as we are getting closer to the start of school, I wanted to talk a little bit about mental health and brain health. And specifically that, we're kind of taught and raised, and even in my, counselor training, we talked all about mental health, and it really has a lot to do with your brain, which it does, but it also doesn't. And I want to talk about that today on the Cultivating Calmness podcast. So if you've been following me and you've been listening along, I've talked about these types of things before. I'm not going to go into any great detail today. We're just kind of brushing the surface of some of the things that could be going on with you. But when we talk about mental health and brain health, it's not all about what's going on in your brain. There's a lot of other things that are going on in your body that affect your brain. And oftentimes people say that your gut is your second brain. I even like to say that it's your primary brain because, what you feed it, what you give it is going to affect your brain. And if you don't feed it anything, right, your brain's going to be affected. If you feed it all the wrong things, your brain is going to be affected. If you feed it all the right things, your brain's going to be affected. So, you have to feed your gut in order to affect your brain. And so, like, a lot of our problems can start in our gut. So, gut health is a primary contributor to your mental health. If you've never heard that before, now I want you to just start thinking about that. Like, what are you eating? Is your food maybe getting digested appropriately? Do you have things like acid reflux? Do you ever get that like pressure in your chest and that like acidy feeling like stuff's burning in your chest, right? Do you have acid reflux? Are you having at least one bowel movement a day? At least one, if not more, right? You shouldn't be having 10, but they say you should be having between like 1 and 3 ish, depending on what experts you talk to, bowel movements a day. If you're not, you're experiencing some form of constipation or diarrhea. And, we don't want to be on the extremes, but we want to be there in the nice middle. And I've had my bouts of that, going up and down. And I definitely feel different when I'm not able to go to the bathroom regularly. And, that, gets me to thinking about like, well, what have I been eating or what have I been doing the last few days? And I know when I haven't been eating as well, or maybe I've had a bunch extra of stuff maybe I shouldn't be, or like that aren't really good for me. Um, that, my bowel movements will change. I know TMI, I'm not trying to get too gross with you. Um, but right. These are some things you can ask yourself. Pay attention to them. Do I have acid reflux? Am I having regular bowel movements? Um, do I often feel bloated or gassy? Am I having a lot of gas, whether it's burping or farting, passing gas? If you're having those things, those are signs that maybe your body isn't tolerating something you've eaten, as well as maybe somebody else. That doesn't mean that it's like a bad food. It can be, but it also might not be good for you. That's another key factor here, is that not every healthy food is healthy for everybody. Um, and so I recommend, getting like a food allergy test to find out, what really is and is not working with my body. So as I maybe am trying to work on transitioning or eating healthier, I am learning what is like best for me versus like my friend over here who also eats healthy and isn't experiencing the same problems as me. Um, if, you're having acid reflux, that's a sign that your stomach is not able to digest the food that you are giving it appropriately. Usually, not maybe in all cases, but usually means you actually have low stomach acid. And the valves and the things on either end of the stomach are releasing, pressure and or gas because it's just not in the right ratio. If you have low acid or your acid is not at the right pH, not acidic enough, then you're not going to break down food. If you're not going to break down food, it's not going to pass into your intestines, into your and into your colon in the form that it needs to be in, right? So it's this domino effect. Um, if you're always tired, right? We say that sometimes is a sign of depression, which it is, it can be. But if you are like lethargic and tired and doing simple tasks makes you feel really drained, there could be other things going on. Low iron is one of them. Do you have enough vitamin D? What about your B12 levels? What about your magnesium levels? These are things that typically your primary care provider, your family medicine doctor, aren't always looking into. Vitamin D, yes. Iron sometimes, but also are they looking at the correct iron? Are they looking at the iron that's readily available in your system? Or are they looking at the iron that is the stored iron? And I don't know the technical terms, and I'm not saying them correctly, but there are different numbers that they should be looking at to determine what really is the iron doing in your body. Um, because they're different. And one can make it look like you're doing fine, and the other can make it look like, oh, you're not doing so hot. Um, and when put together, that will give you more information about your system. You know, your hormones play a role in your mental health. Your mental health plays a role in your hormones, vice versa. But really, like your hormones are driven also by your gut health. If your gut isn't able to process the foods that you're eating, get the nutrients you need, it's not able to then process through, and your liver isn't able to process through the hormones and get rid of what needs to be gotten rid of, and keep what needs to be kept, excuse me, and cycle through like your hormones like they're supposed to. So there's lots of things going on inside your body that most providers aren't talking about in relation to your mental health and, your brain health. All of those things that I just mentioned, plus many more, go into how you are functioning and how well you are doing. And sometimes it's baby steps. We make changes a little bit at a time as we are able to. If it's I can make slight changes in my diet. I have a client that recently decided they were stopping soda and trying to stop a lot of their caffeine, and they were seeing some of those positive effects. In the transition, they were also seeing the negative effects, right? Like the caffeine withdrawal. That kind of sucks. But once you get through that, and you start, on that path, you will notice positive changes. And if you decide to go back and, have the soda, try the things, you may notice that your taste buds have changed. You may notice that, that you actually notice how your body feels when you have those foods. So it doesn't have to be an all at once change, right? For me, it's been gradual. Lots of things changed over time. And, as we were able to buy things and do things, it was a little bit at a time. It wasn't all at once. If you are financially able to do that, great. But most people aren't. It's a little bit here, a little bit there, changing this, changing that. All of those things are going to play a role and have an effect on your mental health. So your mental health isn't about just what's going on in your brain. It's not just about the serotonin that's in your brain. We have to ask, like, why am I depressed? Like, have I had like bad things happen in my life, traumas, grief, things like that? Yes, that can contribute to your depression, but also, what is my gut health like? What is my, exercise routine, if any? What are my hormones doing? What is my iron level? What are my vitamin D levels? What are my B12 levels? Am I having any like omega 3s in my diet? Am I getting, the nutrients that I need? You can think you're getting all the right things, and then you actually get some testing and find out like, ooh, maybe things aren't as great as I thought they were. That was the case with me. I was very deficient in many different things, and I'm working on getting those things back. And when I had some like backsliding, like I couldn't really pinpoint what I was feeling, but I could tell that I wasn't as feeling as good as I had been feeling. So, you will start to notice those things as your body gets back to homeostasis, right? That's that place your body wants to be at. And your body starts to compensate when it isn't in homeostasis, when it is not where it needs to be. Um, so we want to be able to have get our body back to where it needs to be. And when it's not, your body's going to do things to help you to function, right? And that might be making you more tired, making you sleepy because your body's saying, "Hey, I need something. I'm not doing well. Like I've got to force you to sleep because like I can't do any, can't make you do anything else." Um, Something else that just, came to mind is when we talk about gut health, right? There could be different types of infections that are going on that can cause, symptoms for you to have certain symptoms that relate to like mental health. So you could have, there's different things that happen in your gut, like H. pylori or candida or parasites or overgrowth of some kind. Um, and lots of other different types of like gut infections and things that may not be like causing a really obvious maybe reaction, right? You may not notice that it's a reaction, right? It's not like a rash that's on your skin where it's like really obvious and you're like, well, that rash came from somewhere. I gotta clean that up. Um, no, it may just be these like little things that are just happening under the surface, right? Maybe causing your digestion to be all out of whack, which then causes you to not absorb the nutrients from your food, even if you're eating like really super healthy, which then causes you to feel anxious, nervous, depressed. Um, you know, um, lethargic and tired and all these other things. But that's all because of this underlying infection that you didn't know was like going on. That's why looking into those things and asking those questions can be so helpful in figuring out like why mentally you may be struggling. We could go on and on with this for a while. Like ADHD has associations with um, your oral health and your airway. And so if you are a mouth breather, meaning like you breathe through your mouth versus breathing through your nose throughout the day, and especially when you sleep, if you go to sleep and your mouth is open, you're breathing through your mouth and not your nose. That's because your airway, from what I've learned, I'm no expert, isn't open enough. Your mouth isn't open enough. Your tongue doesn't have enough room in your mouth to be able to provide the space for air to flow, for you to breathe through your nose. It's all connected, which then causes you to not sleep well, which then causes these like ADHD symptoms, which then causes you to be on medication for ADHD, which then da 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 da, right? It's something I never would have thought connected, but these are things that I've recently learned, as far as like your oral pathway and your oral health and how like even just recently I've learned and just noticing and looking at history, right? We as human beings, our mouths have gotten smaller and smaller and smaller over time, and we used to have wider jaws, and how has that happened? Asking those questions, and what has that done to the way our face and our jaw and our, or our, esophagus and, the way we breathe, what has that done to all of that and that domino effect and how that leads to the things we are experiencing today? And fixing those things can be really expensive, especially if you like know and you go to the experts. Like I have an overbite. I know my mouth is small. I know my mouth doesn't open as wide as it should, right? What kind of things is that causing for me in my life? I don't think I'm a mouth breather, but it's possible I could be. I haven't had that officially assessed. There's things such as lip ties, the little string here in your lip, tongue ties, little, thing that holds your tongue to your mouth. If they're too tight, that causes problems. And that's a domino effect of problems. You think, oh, it's just a tongue tie. Like, what's the big deal? It causes you to eat weird. It causes texture problems. It causes breathing problems. It causes behavior problems because we have an interconnected system in our body. And when things are not right, it offsets everything. So, your mental health, all of this to say that your mental health is not just about your brain. It's about everything. It's about everything that's going on inside your body. So, looking into those things can be helpful for you in finding answers that you need. Um, and it is a process. And it is sometimes difficult, but that's what I do in my practice is I don't test for those things. But I am aware just like I'm aware of like some of these oral things, so if something comes up, you bring something up, the light bulb may go off in my mind and I go, ooh, hmm, you might look into this. Here's who you could see about that. Or, hey, maybe you should, read up on this thing a little bit and see if that sounds like you at all. Because to me, it sounds like that could be a potential contributor to why you're feeling the way you're feeling. And, then we can pursue that and I can help you find the resources that you need if that is something that is going on with you. So that's what I do in my practice. We talk about the trauma and the grief, and we do the coping skills and the processing and the EMDR. But I can't fix the hormones. I can't fix the gut health. Um, I can help you to be able to do that. I can potentially explain some of those things to you. I can work in tandem with your other providers to help you make the most progress and the best progress that you can. But I can't physically do those things in my office on my own at this point in time. But I do know enough. I do have enough contacts to know that those things are possible. They're out there. They can, it is available to you. We just have to figure out how to make it happen for you. So thank you for joining me today. I hope you have a wonderful rest of your week, and I will see you again next week.